Hello, Assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel. So, today we are going to discuss a very important thing, that is, uh, when will you decide to intubate a patient? Whether I resume this high flow nasal cannula or CPAP or BiPAP, or I should go for intubation. So, there is an important index that is called the ROX index. So, that is SpO2 divided by FiO2 divided by respiratory rate. If the ROX index is less than 3.85, if the ROX index is less than 3.85, then go for intubation. If that is less than 3.85, go for intubation. If the ROX index is more than if the ROX index is more than equal to or more than 4.88, then continue high flow nasal cannula or continue CPAP or BiPAP. Don't go for intubation. And if the ROX index is in between these two, then monitoring of the patient in the ICU and repeating the ROX index at 6 hours, 12 hours, then 18 hours. If it is moving above, that is 4.88, it means continue the same treatment. But if it is going down, that is less than 3.85, then go for intubation. Any delay in intubation can result in a dead end of the patient. If there is a need of intubation and you delay it even in seconds, then it can kill the patient on the spot. So this is a very important index. This tells you whether I should go for intubation or not. So that is the respiratory recap, that is indication for high flow nasal cannula. So we are having two types of cannula: the normal traditional cannula and the high flow nasal cannula. The traditional cannula which we use in our wards, that is actually the traditional cannula. The high flow nasal cannula, unfortunately, till now they are not present in Pakistan, especially in the government setups. Of the private setup, I don't know, but in the government setup they are not present. So the high flow nasal cannula, they use actually oxygen up to 30 liter per minute. So the indication for high flow nasal cannula is acute hypoxemic respiratory failure. Now this is very important. It has got a less role in hypercapnic respiratory failure because it will produce further CO2. It will produce further CO2, and that will actually exacerbate the condition further. And second indication is a risk of post-intubation hypoxemic respiratory failure. So we gave it prophylactically. So the evidence not sufficient regarding the high flow nasal cannula is COPD, it has got no role. Asthma, it has got no role. Cardiogenic pulmonary edema, it has got no role. So on the other side, if you can focus on this algorithm, this is actually algorithm. If there is hypoxemia, there is SpO2 is less than 90% or PO2 less than 60 without hypercapnia. Because if there is hypercapnia and you are giving more oxygen, you are actually deteriorating the condition further, because the high oxygen give rise to further CO2 production. So the low flow nasal cannula, that actually we set on the 6 liter per minute. Now regarding the nasal cannula, the face mask and the CPAP and BiPAP, when and how should you use it, go on my channel and search these topics. I have already uploaded these videos. So with the nasal cannula, 6 liter is the maximum oxygen that you can give. Above 6 liter there is no maximum benefit, because there is a maximum FiO2 reached. Regarding what is FiO2 and how we can increase it, you can watch another video on my channel. So low flow, apply the low flow nasal cannula, and then next step is measure the oxygen. If that is more than 90% or PO2 more than 60 without hypercapnia, if that is yes, then continue this treatment. If no, then switch to the high flow nasal cannula with 50 liter per minute at FiO2 of 1. Now what is meant by FiO2 of 1 or 0.5 or 0.7, you can watch on my channel. There's a separate video on FiO2 only. Now there is the problem: how would you proceed in our setup? Because this is for international in our setup we don't have high flow nasal cannulae, so we proceed to the mask. We proceed to the surgical mask, the mask that is also called Hudson mask, and we increase the oxygen further to the 10 liter and then to the 15 liter. But if still there is no improvement in oxygen, we change that with the non-rebreather mask. Regarding the function of non-rebreather mask, why it is called non-rebreather mask, how it delivers high oxygen, you can watch another separate video on my channel, that is non-rebreather mask. So from that high flow nasal cannulae, again you measure the oxygen. If SpO2 is more than 90%, then follow this route. If that is not more than 90%, go for intubation directly. And you can calculate over here the ROX index as well as discussed earlier by me. So coming downward, the high flow nasal cannulae, continue the high flow nasal cannulae if the answer is yes, SpO2 is more than 90% with high flow nasal cannulae. But what factor would you look or you would address after you have started the patient on high flow nasal cannulae? The answer is CO2. If the person is developing hypercapnia, then you should decrease the oxygen and you should go for intubation. First decrease the oxygen. If the person is not maintaining sats, then you have to go for intubation, because the hypercapnia and giving high oxygen further aggravate that condition. So if IO2 is 0.4 with SpO2 of more than 90%, consider low flow conventional oxygen therapy. So I hope you have enjoyed this video. Thank you for watching. If you have not pressed the bell icon, please press the bell icon and share my channel. Thank you for watching.